Welcome, everyone. We will go ahead and honor everyone's time and go ahead and get started. We are glad to have you all here today. My name is Alicia Carwall. I am from Ask Resource Center, and I will be hosting this webinar. Before we begin, I'd like to just take a moment to share a little bit about Ask Resource Center in case you are on here and maybe have not heard of us before today. Ask is a family-focused nonprofit organization whose mission is to empower the families of people with disabilities. We provide individualized support, collaborative advocacy, training, resources, and leadership development for Iowa families of children with disabilities or special healthcare needs. We serve individuals aged birth to 26, and we also support the professionals who serve those individuals. We thank you for joining us today for the webinar entitled Psychiatric Medical Institute for Children. Jennifer Hodgson is here from Tanager Place. Jennifer has worked at Tanager since 2005 in various positions, including community-based, office manager in the Outpatient Clinic, Department of Development, and now currently the Inpatient Authorization Coordinator. In 2022, Jennifer was awarded the Miller Soaring Above Employee Excellence Award for her commitment to the service and the mission of Tanager, which is to provide services to children and families that inspire, empower, and heal. Jennifer enjoys working closely with families and others to help them on their path of mental well-being. Thank you, Jennifer, for being here, and we will let you take it away from here.
All right. So I'm going to talk to you a little bit about PMIC and the different, some of the stuff will be the same, most of the PMICs in the state of Iowa, but some of it is specific to Tanager's inpatient program and PMIC program. So I just wanted to put that out there first. So that we will, so the first talk about is that Tanager's PMIC, we use a RISE framework for treatment. Most of the different PMICs in the state of Iowa will have some sort of treatment framework that they use. Tanager uses RISE, which is a resiliency framework. And this kind of explains a little bit that our programming takes place in a home-like setting and centers around developing social coping and problem-solving skills. Our goal is to use trauma-informed care components to help youth reach their full potential and build positive, strong relationships so they can return home as soon as possible. The Tanager team for our inpatient, a child psychiatrist, nursing staff, master level therapists, counselors, case manager, and then direct care staff to make sure that your child receives the care that they need. Our Tanager program is, we have 4 cottages that are like PMIC. Each one of those cottages has like their own recreation room, a laundry room, bedrooms, bathrooms. All of the kids eat meals in the dining room of the cottage. There's a full kitchen available in every cottage, but most of the meals are made in our main kitchen by the kitchen staff, the cottage at meal times, except for on the weekends that cottage staff and kids do make their meals. We have different, we feel that a lot of kids need that outside recreation component to their mental well-being. So we do have a lot of side areas for kids to go to you know, get some of that physical activity as well. We have an indoor gymnasium. We have a playground, a baseball diamond, basketball court, gaga ball, walking track. We have a huge green area where they can play soccer, fly kites. We do have some bikes and scooters and things kids can use as well. We do activities in the community on a daily basis as well, because part of that learning and what they're learning here in PMIC needs to be applied to the community as well as the home and the school. So we do take our kids out into the community, such as the YMCA, the library, different stores and within Cedar Rapids, bowling, different things like that, just so that they can use the skills that they're learning here within the community as well. We use different treatment modalities, such as collaborative problem solving, cognitive behavioral therapy, dialectical behavior therapy, expressive arts, play therapy, and recreation. Tanager does have an art therapist and a music therapist that work with the kids, so they can have appointments during the week with our art therapist if that's something that them. And then all of these different treatment modalities are used both in individual, group, and family sessions as we move through the treatment for the kids. Okay, so might be thinking like there's a lot of questions on like what is necessary, what do I have to do, how does my child qualify for PMIC? And there's a lot of the qualifications are based off of what the state Medicaid requires for approval for an authorization of PMIC. And they require that the child has had psychiatric hospitalizations. They have current psychiatry and med management services. They have current therapy, individual, group, or family therapy sessions. And if they're on Medicaid, that they have current BHIS. So we have to kind of prove, we have to have proof of that prior to moving along in the referral process, just because we know like if you don't have those services, it's going to be really difficult to get you approved for a PMIC stay. And unless there are some more rural areas in Iowa that don't have access to BHIS or therapy on a regular basis. So we can, if we can prove that that isn't available, or you've been on a waiting list for BHIS or something like that, then we can move forward. But those are generally the 4 things that they want to see before they would move on for looking at them. And the reason for that is because they want to make sure that children and families have exhausted all of the outpatient services available to them, and that PMIC really is the last resort for treatment for that child. So the other guidelines that we look at is the behaviors that the client is exhibiting is the reason why they need out-of-home placement. Are those behaviors only happening in the home, or happening in the home, the school, and the community? We want to see if it's only at home, then they want to have more in-home services to try and get that behavior. But if they see it, if we see the same behaviors at home and school or out in the community, then we can move forward with looking at the authorization. Tanager's PMIC, we only accept ages 10 through 18. And then we have an ICFID program too that we do 9 through 18. There are PMICs in the Iowa that do go down to the age 5. We have set that 10 to 18 age range just because it's very difficult to have children that are under 10 and 17-year-olds in the same cottage. And so there's a huge difference in developmental how that child is able to move through the treatment when you have somebody that's 8 or 9 and then a few kids that are 16 or 17. PMIC is also only until the age of 18, so they aren't able to after their 18th birthday. So generally, we won't admit a child that is within 6 months of their 18th birthday. because a PMIC program is usually 4 to 6 months. So if you have somebody that comes in and they turn 18 in 3 months, they haven't really been able to go through that entire treatment program. Tanager's programs are co-ed, and so we try to keep the genders balanced, and we do serve the LGBTQ plus population. So most of we have one cottage that is all female, but our other cottages are co-ed. And then a few things to remember about PMICs, because this question comes up a lot. PMICs are not a locked facility. And so we need to be able to look at each child individually, and youth that have a lot of elopements from and from home, we would have a difficulty being able to admit them to our PMIC because of the level of elopements they've had, and we're not a locked facility, so they can run, they could run from our facility as well. And our kids do attend school off campus in the Cedar Rapids district. So then you have the possibility that they could elope from school as well while they're in treatment. Tanager PMIC isn't able to provide care for children with high-risk behaviors, such as high levels of physical aggression. It puts the safety of child, the other children in our care, and the staff at high risk when there's a lot of physical aggression, and not able to get that child to calm down. And so we have to look at that physical aggression at the very beginning to see where we're at, and is that in several different is that physical aggression at school and at home, or is it just in one of those situations? We do require that all youth are stabilized before entering our program, which means sometimes children will need to go to a hospitalization to a PMIC. A lot of times we do take kids that are hospitalized and they've been stabilized, so now they're able to step down from that higher level of care to a PMIC setting. And Tanager isn't able to provide care for children with complex medical needs. This is staffing limitations available for around-the-clock care, such as around 24-hour on-site nursing. But each PMIC is able to, in the state of Iowa, there are PMICs that are able to care for children with those complex medical needs, such as diabetes or seizures, things like that. But at this point, Tanager isn't able to do that. Okay, so funding. PMIC pretty expensive. The current rate is $464 a day. We have authorizations are submitted to both commercial insurance and Medicaid. If a family comes with only commercial insurance, we do have them apply for Medicaid at the time of admit, because commercial insurance won't always pay for an entire stay at PMIC. So we have to go by the guidelines for Medicaid, so that once you're here, your child is here, then they can get on Medicaid, and then they will the PMIC stay for them. There's also the ability to do private pay, but that can get pretty expensive when you're looking at $464 a day for 30 days and then 4 to 6 months. So we want to make sure that we have some other sort of payer for the stay. Like I said, if you don't have Medicaid admission, we attempt to get days authorized with your private insurance. Sometimes insurance coverage varies, and a lot of times insurance will say that they'll cover inpatient stays, but the level of care that PMIC is different. And because we don't have 24-hour on-site nursing, make a difference to those insurance companies, and then they wouldn't cover your stay here. So what we want to do is we want to send in your authorization to the state of Iowa, making sure that, yep, you would be somebody that your child would be a child that would benefit from PMIC and meets all the criteria, so that once they're admitted and we get that Medicaid coverage, then we know that MCO is going to pay for their stay here. There's also client participation, and that is mostly for those children that get in those families that have some sort of comes in for their child, such as Social Security, child support, adoption subsidies. The state of Iowa makes that decision. It's not based off of Tanager or any other PMIC facility on whether or not a family has to pay that or not. It's all the state of Iowa. So if they're paying, giving you an adoption subsidy for a child, or you're receiving child support, the state of Iowa requires that amount of payment that you receive to be paid to the facility that your child is at, and then you get to keep just a small portion of that to help with some of the things you might have to, like clothes or traveling to see your child. So PMICs can be, you can make a referral just as a parent. So if you have a child that wants to be in PMIC, or that you need to have referred to PMIC, you can make that referral yourself. You don't have to go through a provider, you don't have to go through the courts or anything like that. You can fill out a referral form, contact PMICs, and try and make that referral yourself. We also take referrals from different providers and mental behavioral health hospitals, crisis centers, juvenile court officers, HHS workers. So we get referrals from a wide variety of different people that may work with your child and family, or even from yourself. Tanager strongly encourages referrals to come in through our website and our online referral form, because that does ask a lot of questions and gives us a lot of information to look at and start that, looking at that information, seeing if you would qualify for PMIC, if we should refer you to a different program, if your child would be a good fit in our program, or if we can give you information regarding some other PMICs in the state that might be able to want to look at. Before you go to all the work of filling out an application and releases and everything, the best thing to do is to go on and do that online referral form. I always encourage families to really answer those questions truthfully and completely to help determine if PMIC is appropriate for your child, or if we should get some other services recommended for you. And that's because when you don't know about the child from the very, don't know what their behaviors are, how they are at school, how they are at home, how they are, at swim lessons or basketball practice or something like that, then you don't see the full extent of those behaviors, and we can't make a really good decision on whether or not our PMIC program is going to be the right fit. So once you fill out the referral form, and we can move forward with possible looking at that child for place, I will send you out an application and then releases of information. Once we get that back and we get releases of information back for all of the different providers that you currently have or you've had in the last couple of years, we'll request information from those providers. And then we're able to review that information, decide if we can proceed to the next step, or if at that point we need to deny them admission to our program. Once we want to move forward to that next step, Tanager does a assessment with the child and family. And we do that either in person or we do it via Zoom. And that's really a time for us to ask some more questions, the family to ask some questions, and to get some information from the child as well. Just what was filled out in paper, and to meet you, make sure that we're able to meet the needs of your child and family. And then if we move on, if we decide at that point that we could work, that we would be a good fit, then we'll talk to the family about admit. If not, then we would let the family know that we don't feel like we would be a good fit for your family, and give them some other options that they could try. And the education, so once your child is admitted, and this is part of the guidelines too while you're looking at PMICs, is because it's different with each one. Tanager does not have a school on campus for kids to attend. They have to be able to attend public school in person, not online, while they are at Tanager. Sometimes this is not ideal for all kids, because some kids need to do online schooling, and they're not able to go in person. So we would not be a good fit for you at that point, because we don't have the staff available during the day, or the teachers available to online schooling or school on our campus. There are some PMIC facilities, though, that do have schools on their campus, where their kids go to school there and they don't have to leave campus to go to school. And then there are some that allow for online learning as well. So when you come to an admit, we really encourage both parents to attend if there is more than one parent. But at least one parent or guardian must attend the admit. We encourage both. If there are multiple parents, we encourage everyone to attend, just so that everybody can be on the same page as far as the treatment program, what to expect, making sure that everybody has a copy of our client and family handbook and is able to be able and ask any questions if they have any. A typical admit here takes about 1.5 to 2 hours. You'll meet with me for a good part of that time to fill out paperwork and answer any questions that you may have. The nursing team will come in and meet with you and talk about get medications, go over some of that. They do a small, I guess they do a small physical or whatever with the child by just, getting basic information from the child: height, weight, blood pressure, vision, that type of thing. The counselor for that individual cottage will come in and meet with you about individual sessions, family sessions, and talk about how that will look, what that will look like. Get your first family session scheduled. Talk about how the treatment plan progresses, and the different types of that you would have. And then our case manager will also meet with the family, and they set up like the first 30-day staffing. They explain to them what their role is. As a case manager, we'll stay with that family from admit, and then work up. Once we get to discharge, they will also be working with that family to make sure set up throughout the entire stay, so that when they discharge, then they have those aftercare services set up. So then after all that paperwork's completed, we're going to take all of your child is going to take all their belongings to the cottage. Staff will need to inventory and make sure everything, and they're able to keep what they brought prior to moving into their room. So most likely you won't be able to help your child set up their room. Staff will help, but if there's a lot of times we can take parents in to kind of show them what where their room's gonna be and what the cottage looks like. I think I mentioned a few times about family participation, and that's really a big part of PMIC placement, that family participation. And viewing PMIC placement as not a just, and this is Tana, we view it as not just a fix the child type of treatment. It's more of a family as a whole. And we work with the child, of course, because they're in treatment, they're here every day and they get treatment, but it's really the family as a whole. So it's important to be ready for some participation while your child's in PMIC. The counselor meets with the family at least every other week. They have family treatment goals. There is availability to do telehealth or Zoom services. But it's very important to have those family sessions at least every other week and start really working on some family stuff as well. Your part of our treatment is also you're expected to be involved in your youth placement and treatment. So we really encourage you to have day passes, on-campus visits, and then taking them for some home visits. It's important that the child that is here has communication with their family and is able to really use those skills that they are learning here while they're with their family. So if you have your child in PMIC for 4 to 6 and you've only taken them home 1 or 2 times, we can't really see if that child is going to be able to use those skills in the home. And so it makes it really difficult. That's why we really encourage you to have at least some sort of home visit or day pass every other week, and communication via phone with your child while they're here, just so that we can make adjustments to their treatment as well if we need to, but also to see how to make sure that once they discharge and they do go back home, that they're successful. And this is, I've just included what our philosophy of care is. We want to be able to help move youth through the program and assist them in reaching their goals. So a lot of times we'll talk to the kids about what their long-term and short-term goals are. And it really is beneficial for, like we said, the family treatment goals as well, and that we're moving towards completing those family goals while that individual is also completing their own goals. Our whole programming is centered on a philosophical view that all youth do well if they can, and there's no such thing as a bad kid. It's focused on core practices aligned with being trauma-informed, resilience-based, and promoting restorative practices. So every day is a new day. You know, you might have some to work on before you're able to move on with your day. If you had something that was not, you know, you had a setback in your treatment or something, you need to work on. You need to work on that treatment, and you need to maybe restore some sort of relationship with another staff or another child before you're able to move on with the day. And then we just we keep moving forward. So our framework is a RISE, Wellness and Resilience framework. We realize that impact the impact that exposure to adverse experiences and toxic stress has on a person's well-being. So we really look at that when a child is here. Like we do a RISE assessment with them, and we find out really what type of experiences have they had as in their childhood, what type of stress have they had, and how is that affecting what what behaviors we're seeing now. And then we also we respond by helping in ways that reflect awareness of traumas, diversity, and consistently support the person's recovery. So no matter what that trauma is, even, like what degree of trauma that is, we're working on that child being resilient and working through that trauma. So from the time of admit, we really start talking about discharge planning. So when you're in your admit or close, your first family session, they're really going to start, okay, 6 months from now is, the end of April, or the end of is May 25th or something like that. That's really what we need to have our goal be, is at 6 months, we're discharging from our program. We have kids that discharge in less than 4 months, kids that are here a little bit longer than 6 months, but it's really determined on that child and family and how quickly we start working through that treatment program. So it's determined when your discharge is, and then the child and the family is required to engage with the program. And our case manager will help explore any aftercare services that benefit your child and family. So usually by the time of discharge, we have services set up for you in your community that will help you with, so they'll have therapy, BHIS, the integrated health homes, medication management, maybe a referral into Big Brothers Big Sisters, or a referral for other services in your area that would be really successful and or help the transition back into your home and community to be more successful. And I've included a slide here because Tanager does have 2 different inpatient programs. So we have both PMIC, and then we have the ICF program, which is the intermediate care facility for the intellectually disabled. So we've talked about PMIC. The ICFID program that we have, just briefly, is for children and adolescents with mild intellectual disabilities and behavioral challenges. And we have them in a safe, supportive environment. So there's some mental health stuff going on, plus that ID diagnosis, or that ASD diagnosis. So they're more success. It's possible that they could be more successful in that type of a program versus a PMIC. And we really look at that when kids come in with that lower IQ. Are more suited for an ICFID, or would they be able to be in our PMIC program? There are 7 different PMIC facilities in the state of Iowa. 7 or 8, I guess. So there's Children's Square in Council Bluffs, and Oaks has a PMIC in both Cedar Rapids and Mason City. Orchard Place is in Des Moines. Hillcrest is in Dubuque. Rosecrans Jackson Centers in Sioux City. The Boys and Girls Home in Sioux City, and then Tanager and Cedar Rapids. There are a couple of these that are what they call a dual diagnosis facility, and that's where a child may have a mental health and a substance abuse, and they need treatment for both of those. And those kids are the ones that we would refer on to one of those dual diagnosis facilities, Hillcrest or Rosecrans. And my last slide is just about Tanager. So I guess if we have any questions, I can answer any questions now.
The first question we had was, you mentioned that Tanager is not able to accommodate those children that do have elopement behaviors or at-risk behaviors, or even maybe high medical needs, what are the options for our families that would fall into that category? Are there anything in Iowa or out of state, or how does that work?
So with the elopement, you have to, we look, are they running away from home because of something that's happening in the home? Are they running away from school because of something that's happening at the school? So we do take some kids that have some elopement, but we really look at the level of elopement that they have. If running away from school or running, then I would suggest finding a PMIC that has an on-campus school, because then they would still be on campus and they don't have to leave campus. So like at Tanager, our kids get on a Cedar Rapids school bus in the morning and they take them to school. They're at the school all day long, and then they ride a bus back to. So there's a lot of opportunity there where they're not at Tanager, and so they could elope from school or not get on the bus or get on the wrong bus, things like that. The medical needs, we don't take kids that have like diabetes, or because we don't have that 24-hour nursing or the staff available to meet those needs on a 24-hour basis. So, but there are PMICs that do take kids that have a seizure disorder or have diabetes. And so then I would refer families to those PMICs if they're looking for placement. Just, like Four Oaks and Mason City can take kids that have a seizure disorder. So maybe try them and see if they have availability or they're able to meet your needs there. The high risk behavior, like the high levels of aggression, Tanager doesn't use seclusion rooms. We don't the therapeutic hold of MANT as the last resort. So keeping everybody safe when somebody has a high level of aggression is harder for us because we don't have that seclusion room to have kids go into to calm down and get away from the rest of the area, the rest of the kids. So that's why we look at the level of aggression they have and whether or not we can meet their needs here.
Thank you. I think the only other question I'm seeing so far, unless someone else has anything they want to drop in the chat, is how would you encourage those families? I know sometimes we're hearing from families that it's challenging once it is time to transition back home, and maybe they don't feel as though there's as many services as they could use or something. How would you encourage those families or give them some advice to help with that transition and making it smooth back into the community?
I think there's a few things with that, and the level of involvement that a family has while their child is in treatment, and really talking to the staff here, working with our case manager or the counselor, somebody at the different PMIC, really working with the staff to make sure that you know what's available in your community and sharing that information with the staff. And Tanager, we make sure that they have appointments set up afterwards. So they will have their first medication management set up with a doctor after discharge, within 30 days. They'll have a therapist with weekly appointments set up within a week or two after discharge. And we really work hard to make sure that they have all of those services set up. Another big program and service that's available through Medicaid is that integrated health homes. Very good. It's a very good service to get set up for families when they're on Medicaid, because I see it as their case manager for the family. So it's free through Medicaid. If the family needs help getting services or a referral somewhere, or even navigating like the IEP and 504 world, that type of thing, that IHH team is ready to help you. They're not going to be constantly and I'm speaking because Tanager has an IHH program as well. So I'm speaking because so what our program, they're not going to be calling you if you need help. They're going to check in with you once a month and say, hey, just checking in. Is everything going okay? Do you need any help? And at that point, if you say, nope, everything's going okay, then they'll be like, okay, I'll talk to you next month. But if you need help, they're there and you've got that worker. So we try to get all of our kids set up with an IHH team while they're in PMIC, because it is a service that you can have and is paid for by Medicaid while a child is in PMIC. There's not a lot. They can't have any, well, a child's in PMIC, they can't have any outside therapy or BHIS, but they can have IHH services. So we try and set up our kids with that IHH program, home address and home county. And then that's somebody we work with as well to try and find different services that are available in that community for this family and for this child once they discharge.
Okay, thank you. Another question we have, it looks like we have one or two more here. One question was, sorry, I'm just making sure I catch them here. How are our families and children supported if they have an IEP when they move into a PMIC and enter that new school system?
So that IEP will transfer to the new school system and that 504. And we notify the Cedar Rapids School District as soon as we know when an admit is going to take place. And so they know what school that child is at. So they will reach out to that school, try and get a copy of that IEP so they can start making sure things are in place prior to that kid starting school. And a lot of times what might happen is a child will be admitted to us and then maybe it's 3 or 4 days before they actually start school at one of the schools, because the school system is still trying to make sure that they have all of those things in their IEP or their 504 in place before the child goes to school.
Okay, and then when that child is discharged, kind of on the other end there, will staff from Tanager attend that IEP meeting when they're transitioning back into their home district, or how does that work?
I think that they would if they're invited to attend. Usually see the Cedar Rapids schools, if there's time, they will have a meeting for their IEP or 504 with the Tanager staff and the family and the school. Sometimes in the past they have invited the homeschool district as well to attend those meetings to kind of try and work all together. The Cedar Rapids schools also get notification when a child is discharged from PMIC and what school they're going to be attending, so that they're able to get that any type of updates or to their IEP or 504 are able to be sent back to that home school.
Jennifer, I'm going to segue in here. Would you say that it's really up to the family then to make sure that all those pieces are falling into place, to be the ones inviting the home or resident district to make sure that communication is happening between Cedar Rapids School District and the home district?
I think that, yeah, the family, they're the piece that has that link with that home school district to be able to know who to talk to, making sure that, you know, that homeschool and keeping them up to date as well. Like, my child is going to go to PMIC at Tanager in 3 weeks, and Cedar Rapids be requesting their IEP. Please send it to them as soon as you can. Send them their transcript so that they can try it. Because when a child admits, and this is a little bit off, but when a child admits halfway through a semester, you have that fear of losing credits and partial credits that they've already done. So another thing that our high school here does is they try and match them up with classes that they were already taking so that they can continue getting, and they are able to get those credits still. So really, families communicating with that home district that their child is going to be going to PMIC and not waiting until the day of admit to that, hey, my child's not going to be there anymore. They're going to Tanager PMIC, and then it's kind of a shock to them. But also, you're talking about discharge from the very beginning of a stay. So letting that school know, like, my child's only going to be gone for 4 to 6 months. And so we need to make sure, like, and once something's working at the Cedar Rapids schools, or the staff here telling you this is an intervention that works really well for the child, really communicating that with that home school district, so that they know what's going on and it's not a shock to them. Like, I've talked to some school districts, and like, okay, just want to make sure that you're aware the child is coming home tomorrow and is going to need to go back to school there. And they're like, oh, we had no idea that he was going to be starting school back here tomorrow. We don't have anything in place. We don't know. We were going to have to get paras hired, things like that. So really making sure that communication with the school too, so that they're not stuck at the very last minute trying to scramble to get things in place.
Thank you, Jennifer. Brooke, we read your comment, and yes, absolutely, the resident district should be invited. And I would even go one step further and just acknowledging that sometimes that might be, like you're referencing, Jennifer, if things are kind of happening last minute and maybe that communication has not been there, it might need to be that the meeting is rescheduled so that home district or resident district can be there, because we know that's a vital part in transitioning that student back and having success once they're back home. Does PMIC placement affect a child's Medicaid waiver eligibility? And so I know, Jennifer, you and I have talked about that. If you can address that. So meaning I assume they're meaning if a child is already on a waiver, how is that eligibility impacted once they are admitted to a PMIC?
So yeah, so they're not able to stay on the waiver once they're admitted to PMIC. But what we would do is their MCO would know that they were on the waiver. They're now getting close to discharge, and they need to get them back on the after discharge. We're also able to talk to the MCOs when children are in PMIC. But if we're trying to get them, if we know that having waiver services once they discharge is extremely beneficial to that child, we're going to talk to those MCOs and Medicaid to try and get them on that waiver waiting list, and use what they call a reserve capacity slot for children that are in a higher level of care and discharging into a lower. So we try and work with them. But unfortunately, once they admit to PMIC, then that waiver they are discharged from waiver services.
Do you think that I would imagine that's a real fear for parents,
Right.
that they're losing waiver services, but in your experience, if they come in on a waiver, are they typically able to get back on the waiver with one of those reserved capacity slots pretty quickly?
I think so. And I think it's all about communication as well, because once you're on a waiver, you have that team that you're working with at whatever agency, plus you have a case your Medicaid MCO that knows about your child, and that they're available as well. So as long as everybody is communicating with each other and making sure we're all aware that he was on a mental health waiver, this is the case manager from AmeriGroup or Iowa Total Care or whatever, and then they're invited to the staffings as well, so that everybody is on the same page. And it's not a shock for discharge that, oh my goodness, now we've got to try and get them back on the waiver. And it's a 3-month waiting list for those reserved capacity slots. But if we knew from the very beginning that, hey, and that's why we're looking at that discharge date from the very beginning too, so people know kind of a time frame, like 6 months from now, I hopefully will have a spot to get him back on the waiver.
Sure. Thank you, Jennifer. All right. Do we have any other questions?
Not seeing any, but of course, people can feel free to add one.
I'm not sure if I touched on the whole like CINA and whether or not you need to have a CINA for a child to be in PMIC, and that's not required at all. And having a CINA for your child or a court order for PMIC does not speed up or guarantee that you can have a placement in a PMIC. So a court order will say that the court recommends PMIC services, but they aren't able to say that they need to be admitted to a PMIC on this date at this time, because if we don't have beds available, we can't admit to a PMIC program. If we don't think our program is going to be the best fit for that child, then we can't admit them to our program. So getting that CINA or that court order for PMIC doesn't necessarily mean that that child is going to be admitted to a PMIC.
Jennifer, thank you for touching on that. I know you and I talked about the fact that we do hear from families who have been advised to file for a child in need of assistance, is what Jennifer's referencing there. And so what we have seen happen with families and what Jennifer has just alluded to is that filing for a CINA for a child in need of assistance does not guarantee that a child is going to receive a PMIC placement at all or sooner. The admission process and criteria is still going to be the same. So we want to make sure that myth, I guess, is debunked, because obviously that's a very serious consideration for families to have to make.
Right.
All right. Well, thank you again, Jennifer, for presenting today. And thank you, those of you who are here today attending. We appreciate you hopping on.